Hello everyone, this is Dr. Madhusudan Rao on the program I teach medical students. Today I talk about the cerebellum, an organ which is required for us to perform the voluntary act with great deal of perfection. Okay, if our cerebellum is not functioning properly, our voluntary movements are broken into components. We may fall frequently, we may not be able to execute our voluntary act properly. Okay, there is bizarre movements, our speech is disturbed, and you will be identified very easily if you have got the cerebellar dysfunction. So this is very important to know the anatomy of the cerebellum, its blood supply, and the causes of cerebellar disorder. The cerebellum has got two hemispheres, cerebellar hemispheres, in which the body is represented, and the truncal musculature is represented in the vermis, and flocculonodular lobe is responsible to maintain the balance of your body. And this picture shows some of the clinical manifestations of cerebellar dysfunction, like dysarthria of the speech, rebound phenomena, nystagmus, intentional tremor, etc. And this slide also shows few clinical signs of cerebellar dysfunction, like ataxia, unable to walk properly, intentional tremor, dysmetria, hypotonia, pendular knee jerk, etc. Then coming to know the causes of cerebellar dysfunction. This is very important. Cerebrovascular diseases, that is, vascular lesions in the arteries supplying the cerebellum. Cerebellum receives the arterial supply or the blood supply through branches of the vertebral arteries and the basilar artery. Next, multiple sclerosis also affects the cerebellar function. Alcohol, the commonly consumed drug, results in dysfunction of the cerebellum. Inflammatory diseases like encephalitis and drugs used in the treatment of epilepsy. Some posterior fossa tumors in children is the primary malignant tumors. In adults, acoustic neuroma, meningioma, and metastasis, to quote some examples. Here is the acronym VANIShed, used to describe the signs of cerebellar damage. V stands for vertigo. Vertigo means a delusional feeling of rotation of the environment, rotation of the surroundings. You feel the surroundings are a sort of oscillating around your body, or spinning of the surroundings around your body. Ataxia, that is, inability to walk with balance. Nystagmus is the pendular movement of the eyeballs. Intentional tremor, that is, when you are attempting a movement that is disturbed by the tremor. Slurred speech, that is dysarthria. Hypotonia, weakness of the muscles. Exaggerated broad-based gait, that means your stance is not normal. Your legs are put apart and you are walking with a broad base. Dysdiadochokinesia, that is, inability to perform alternate movements of the forearm. That is, turning the arm downwards and alternating with the upward movements. Well, this picture shows the appearance of the cerebrum or the say brain. It has the cerebral hemispheres on the top. Inside is the diencephalon, that continues into the brainstem, which consists of midbrain, pons, and medulla, and lowermost part below the cerebral hemisphere is the cerebellum. To quote some important signs of cerebellar disease, it is a repetition, but we are going to give a little more explanation related to the cerebellar disorders. Signs of cerebellar disorder: stance, gait, titubation, position of the head, rotated or tilted, decomposition of the movement, that is a voluntary movement, ocular movements, dysmetria, rebound phenomena, ataxia, dysdiadochokinesia, hypotonia, tremor, and dysarthria. Stance. What is the stance in cerebellar disorder? Your legs are wide apart, you are unstable and sway and not able to stand. That is, there will be history of repeated falls because of the inability to stand properly, secondary to weakness of the muscles. As hypotonia is the manifestation of cerebellar dysfunction. Folliculonodular lobe dysfunction. Okay, dysfunction of the folliculonodular lobe results in the inability to sit erect. That is, your truncal muscles are not maintained in balance, and also inability to walk straight. That is, because of the your balance is disturbed because of the disturbance of vestibulo vestibulospinal pathway. Vestibular nuclei are connected with the cerebellum. Cerebellum is connected with the vestibular nuclear complex. Vestibular nuclei are in turn connected with the oculomotor nuclei. Okay, and the information is sent to the higher centers. Higher centers again project their fibers to the red nucleus, reticular formation, and other extrapyramidal nuclei, which in turn are connected with the lower center, that is spinal cord, anterior horn cells. That is the projection of the higher center through the extramedullary pathway to the spinal cord in order to maintain the balance and the gait. So cerebellum is responsible because it is connected with the higher centers in the pons and in the cortex. Cortex in turn sends the efferents down to the lower centers and various nuclei in the brainstem. Okay, that is reticular formation, red nucleus. Okay, which in turn sends the descending fibers in the form of extrapyramidal tracts to innervate the anterior horn cells and ultimately to bring about the voluntary movements. Okay, these pathways are very important in order to maintain the balanced, well regulated, smooth voluntary act. Gait is disturbed. It is broad based, unstable, and swaying to side due to hypotonia. Tandem walking is the earliest sign of cerebellar dysfunction. What is tandem walking? Ask the patient to walk in a straight line, bringing the heel of the one foot to touch the great toe of the other foot. Okay. When the patient is asked to walk on a straight line, he has to put your foot of one leg and keep the other foot heel touching the great toe of the other foot. Okay, that is the tandem walking. That is the earliest sign of cerebellar dysfunction because great deal of balance and the well regulated voluntary act with perfection is required to carry out the activity. Say for example walking. Titubation, head and body tremor, rotatory or rocking movement. Okay, it is non-localizing sign. Well, these are the manifestations of the disease cerebellum. Then let us go little more information related to the cerebellar connections with the rest of the neuraxis. Number one, it is connected with the pons. Okay, pons they have got the nuclei of the motor cranial nerves. For example, vestibular nuclear complex. Okay, vestibular nuclear complex receives the signals from the from the semicircular canals, ventricle, and the labyrinth. Saccule, semicircular canal, and the ventricle. And the nuclei of the vestibular nuclear complex, they send axons, they cross the midline and reach the cerebellum of the opposite side. Okay, through middle cerebellar peduncle. Okay, that way vestibular nuclei have got the function to control the floccular flocculonodular lobe, which is responsible to maintain the balance of the body. Okay, then cerebellum sends efferents to flocculonodular nuclei. Flocculonodular lobe sends the efferents down to the uh, nuclei of the motor cranial nerves in the pons and reticular formation and reticular formation, that is nuclei of the reticular formation, they send the axons to the lower center, that is spinal cord, in the form of reticulospinal tracts. That means this is the circuit. Vestibular nuclear complex in the pons, connecting the flocculonodular lobe of the cerebellum on the contralateral side. Well, flocculonodular lobe in turn innervating the reticular formation in the pons, which in turn sends its fibers down to the spinal cord like reticulospinal tract. That is one pathway. The other pathway is the rubrospinal pathway. There is dentatorublo-thalamocortical projection from the cerebellar hemisphere to the contralateral thalamus, that is red nucleus and the thalamus. That is dentatorubro-thalamocortical projection. Okay. From the cerebral cortex, again there are efferents in the form of corticospinal, corticobulbar fibers to innervate the motor nuclei of the cranial nerves as well as the anterior horn cells in the spinal cord, in the sacral segment of the spinal cord. These motor pathways and their network is ultimately required to maintain the smooth execution of the voluntary act. Right? Then, so cerebellar hemispheres They are connected with the spinal cord in the form of spinocerebellar tract. Spinocerebellar tracts are the afferent pathways from the peripheral receptors in the spinal cord to the cerebellar hemispheres of the cerebellum of the same side, ipsilateral cerebellum. The ascending sensory fibers, they reach the cerebellar hemisphere through the inferior cerebellar peduncle. Okay, from the cerebellum, they pass in the superior cerebellar peduncle, cross to the opposite side, and reach the cerebral cortex. Okay, in that way, there are ascending fibers from the spinal cord to the cerebellum in the form of the spinocerebellar pathways. There are descending fibers efferents from the cerebellum, that is cerebellar hemispheres projecting to the red nucleus. From the dentator nucleus to the red nucleus, rendered to robothalamo-cortical projection. Then there is a red nucleus in turn is connected to the lower centers as the rubrospinal pathway. And there is a reticular formation nuclei in the pons which are connected to the spinal cord in the form of reticulospinal pathways, and vestibular nuclei which again responsible to maintain the balance of the body. They are connected to the cerebellum, that is trochleonodular lobe, and in turn they are connected to the spinal cord in the form of vestibulospinal pathways. Okay, so there is a great complexity of the motor pathways in order to get the voluntary act with great deal of perfection. Okay, a lesion in any part of these pathways can result in the disturbed voluntary act. So, blood supply of these organs is so important to avoid the dysfunction of these particular structures. Okay, the vascular lesion could be transient in the form of the transient ischemic attacks TIA. That is because of the some vertebrobasilar insufficiency. That is posterior circulation is disturbed because of so many reasons. Say vertebral basilar insufficiency could be due to the lesion in the vertebral column, that is cervical spine, through which the vertebral arteries run to reach the cranium. So, the disease of the vertebral bodies can result in the compression or the vertebral arteries, thereby cause the insufficiency and poor blood supply to the organs and to the neural axis like the pons, cerebellum, etc. Right? This will manifest as loss of balance, okay, and falls. That is the most common presentation with which patients come to you with the symptoms of say, ischemic, transient ischemic attacks. The individual loses the balance transiently. Okay, sometimes there is a feeling of spinning of the surroundings around the body. That is what I have. Well, with this information, I think you, my dear students, can identify the cerebellar dysfunction as early as possible in order to manage the problems related to the cerebellar disorders. Thank you very much for patient listening. Hope you like this video. If you like this video, please subscribe to my channel. Thank you very much once again. We'll meet you later in the next class. Until that time, this is Dr. Madhusudan Rao. Bye bye.